the same way, they give us a little bit more of a three-dimensional view because you need a little bit of that for the male, but I hope you can still appreciate that back here. Here's the lumbar vertebrae and the sacrum that's been cut down the middle, coming around to the coccygeal vertebrae. And so here's that pelvic canal would wrap around, boom. And they didn't quite, there's the pubic symphysis, but they're giving us a little bit of the pubic bone right there. Okay, so everybody oriented that way?
Yeah.
Because they're giving kind of that three-dimensionality to it, here's where you can see they're giving us the sigmoid colon being cut off here and coming around into the rectum, and the anus going through the posterior part of the pelvic canal, that anal triangle. Everybody good with that?
Yes.
Just like the female. Right behind and anteriorly, just behind the pubic symphysis, this is the urinary bladder. Again, more of a three-dimensional view. You can see the wall. They're showing it like a little bit fuller than in the female for some reason. But still not, it can extend much further up into the abdominal cavity. And there's the urethra leaving the urinary bladder, going through the pelvic floor here, but then instead of just passing straight out, it goes into the base of the penis and all the way out the tip of the penis, okay? Then, obviously, there's no vaginal opening, and if this is the pubic symphysis, just in the same position as the clitoris, suspended from the front of the pubic symphysis, but obviously much larger, is the male penis. And then what I think the real reason that they have a more three-dimensional view is because we want to be able to trace the path of sperm. So the testes reside in this pocket down here that is called the scrotum, and actually forms, I'll show you, now I'm going to put the rest of this in place here so that you can kind of appreciate this. The testes begin their development up in the abdominal cavity in the same position as the ovary, but we call it developmentally the descent of the testes. It happens at and around birth, so sometimes male babies, the testes still haven't descended. In fact, I can show you in our fetal male pig, they haven't descended yet. And as they descend, they drag their blood vessels and also the tube that carries the sperm, the vas deferens, down into the scrotum. And the scrotum forms as a pouch, as part of the abdominal cavity that pouches out from that inguinal region.
Cremaster muscles?
What?
Cremaster muscles?
Well, the cremaster, we can get there if you want. The inguinal canal is this pouching out of the coelomic cavity down here to form the scrotum. That's where men are vulnerable for what's called an inguinal hernia, because remember, we pressurize that abdominal cavity when we defecate, urinate, cough, sneeze, also when we lift things, right? And we use that pressure to help hold the weight, but there's a weak spot there in men that women don't have, and that's where you can get a tear in the muscular wall. It would be quite painful, called an inguinal hernia. So what happens, right, at ejaculation is that sperm, which are formed in the testes, move their way through the vas deferens, that's the name of the tube that carries them, okay, or the ductus deferens or vas deferens, in just a couple of drops of what's called testicular fluid. So millions of sperm would be present in that 1 or 2 drops of testicular fluid. They go through the vas deferens that's traveling in that inguinal canal, or that runs in the inguinal canal, all the way around to the back of the bladder, and that's where you can see this vas deferens coming to join the urethra and in the middle of the prostate gland. The bulk of the semen, right, the approximate tablespoon of thick, whitish fluid that gets ejaculated is produced by the prostate gland and these seminal vesicles that are next to the vas deferens. So the couple drops of testicular fluid with sperm joins that sperm and that semen that's being produced by these glands, and then is ejaculated out what of course would be an erect penis. Okay.
All right.
So it seems like those sperm should be able to jump into the penis from the testes, but they have to make that whole trip around there. Yeah. And I think that might be news or confusing to a lot of people. But what's interesting about this, right, is, and I hope these things help you to remember all of this. In a male sterilization, or it's called a vasectomy, right? Because the vas deferens gets cut. Anything ectomy is when something gets cut, tied off. And to do a vasectomy, it can be done as an outpatient surgery with a local anesthetic just by cutting through the skin and getting to that vas deferens right there close to the inguinal canal. Okay, of course it has to be done on both sides. They find the vas deferens, they tie it off, and then what happens? Those sperm that are being produced, they can't make it past that point. Okay, I once saw a cartoon of this, like that tied off vas deferens and like all these millions of sperm behind it building up. But the fact is, most sperm that are made in the testes never make it out, right? Because men are constantly producing millions of sperm. They just get resorbed back into the walls of the ducts in the testes or in the epididymis where they accumulate. What?
Resourcefulness.
Exactly. What did you say?
Resourcefulness.
Resourcefulness, yeah, you know, like recycling. And that's constantly happening, okay? So that we always have fresh sperm ready for the times when there is an ejaculation event.
I have a question.
Yeah.
So, oftentimes, it's always explained of what happens when men ejaculate,
Yeah.
but at what point in time when it's happening? For instance, during the course, or during the time of intercourse, right?
Yeah.
Throughout the time having sex, what is actually happening with the sperm? At what point in time would it begin that cycle?
So,
Oh, excuse me. Thank you.
so basically, in terms of sperm that are coming fresh from the testes, that's pretty much happening right during that time of ejaculation. Is it not possible that there are some sperm that were left in the vas deferens or even in the urethra, a tiny number of sperm that emerge earlier with what's called, there's a pre-ejaculate fluid that's sometimes like a kind of lubricant fluid that sometimes is produced. Could there be sperm there? Small numbers, but not the bulk of the sperm which really make their way out at that moment, okay? And unlikely to be enough to, you know, to bring about, to fertilize an egg, but, you know, all kinds of things are
So this
possible.
happens quite quickly.
Yes. Yeah, that movement of the sperm through the vas deferens, there's like a
It's not as slow as the ladies.
It's not as
No,
fast as
making
no,
it's not the sperm swimming, it's peristaltic movement of the vas deferens that moves that testicular fluid along. Yeah, those sperm would never swim that fast, okay?
Not that I'm assuming.
So,
I'm glad.
yeah. So,
No babies.
yeah. And so, of course, if there is a vasectomy, the sperm never make it out, they get resorbed back into the testes, and then the ejaculation and the production of semen happens just the same because, remember, the semen's being produced by the prostate and seminal vesicles here.
Prostate and
Okay.
seminal vesicles.
Yeah.
So,
So-
prostate exam.
What's that?
Prostate.
Prostate exam, as you can see, that prostate is, you know, just anterior to the rectum, and so because there's, you know, a fairly high incidence of prostate cancer among the male population
So this whole
past
circle
40
thing
or
right
50
here
years
is
of
the
age.
prostate.
Yeah, that's all prostate. One way to detect whether that prostate seems to have any growths on it is to do a rectal exam. There's a lot of controversy right now about the best way to early detection of prostate cancer and how to get the right kinds of cancer, because sometimes people are being treated for prostate cancers that are unlikely to grow faster than the lifespan of the expected lifespan of the person, and it's a very invasive kind of cancer to treat. So nobody has exactly the right answer, but it's one of those where
And it can't be removed.
Oh, it can, but the question, you know, it's a very delicate kind of surgery to have done, and should it be done if it's not a very aggressive cancer, it might not cause trouble.
Okay.
But, and so is it in